Um, I've been finding out all about mouth cancer today. I've been looking at the various symptoms, and they are very varied. And I note that Dr. Nigel Carter, who's chief executive of Oral Health Foundation, he's spearheading awareness campaign to tell us what to look out for and why it's so important. So welcome, Nigel.
Hello, Carla. Good to be here.
And I've also got Robert with us, and he's going to be telling us about the experience of having it. And that's a very important thing. So, Nigel, it is Mouth Cancer Awareness Month, but really we should be aware of it all the time, shouldn't we?
Yes, absolutely. I mean, we've been running Mouth Cancer Action Month now for the past 22 years in association with Denplan, our sponsors there. And we started off with really people had virtually no awareness of the fact that they could get cancer in the mouth. Now, hopefully, we've driven that forward over the years because it's very difficult to talk to people about the risk factors of getting mouth cancer, what might be causing it, and also about the things that they should be looking for in their own mouths, which mean that they need checking out if it's something that they're not aware of at all. So I think we've got beyond the awareness now. I think a lot of people know that mouth cancer exists. They don't necessarily know which part of the mouth it affects, but we need to concentrate on getting those risk factors across, which basically is tobacco use. So whether that's smoking or chewing tobacco largely in the ethnic populations, excess alcohol, and excess alcohol and tobacco together increase the risk by up to 30 times. And then also in the last 15 years, we discovered that the human papillomavirus, which is HPV, that's also responsible for causing cervical cancer, is causing a number of the mouth cancers, particularly those towards the back of the mouth and into the throat. So that's now something else that we need to be aware of.
I noticed from some of the case studies that I've read that some people get persistent sore throats, and they don't realize that maybe, just maybe, that can be a sign of a cancer. And there was one lady who had a persistent ulcer on her tongue, and that turned out to be a cancer. So there are varied signs, aren't there?
Yeah, absolutely. I mean, probably the most common one is the ulcer that doesn't heal. So if you've got a mouth ulcer that hasn't healed within about 3 weeks, that's really a message to go and get it checked out. Dentists check routinely the soft tissues around the mouth as part of a dental checkup, but we know that dental checkups are challenging at the moment and greater distance in between them. So I think people need to be aware of their own mouth, to be mouth aware, and to actually start examining in the same way that you might examine for breast or testicular cancer. So, have a look in your mouth, have a look at your cheeks, your tongue, under your tongue, towards the back of the throat, see if there's anything unusual going on. So we've got the ulcer that doesn't heal, any unusual red or white patches in the mouth, particularly if those are changing size or moving around. As you said, hoarseness, persistent hoarseness, sore throat, any lumps in the head and neck area. So examine the head and neck. If there's any lumps that are coming up that you haven't been aware of previously, they're all a sign to get along to the dentist. If you can't get an appointment with the dentist, which we know is challenging, then go along to your GP. You know what feels right in your mouth. If something feels wrong, be persistent, because we would much rather see somebody in the early stages of the disease where it's easily cured and much better survival rates than what does happen when people present in stage 3 or stage 4 where the treatment is much more complicated and the survival rates aren't as good.
I see. Before we speak to Robert, I just want to find out why it is there's been a rise in mouth cancers in the last 5 years. And there is, of course, worry about the cost of living crisis affecting it. I mean, can you get free appointments? I mean, how are people being affected during the cost of living crisis?
cost of living crisis and access to NHS dentistry clearly is very difficult at the moment post-COVID, because there's a huge backlog of treatment that those dentists working in the NHS have got to catch up with what they missed in COVID. So it can be quite challenging to get in. And that's where we would say, you know, if you can't get in with a dentist, don't think, oh, I can't get in, I'll let it go. Get along to your doctor, get them to have a look at it as well. Obviously, there is a price barrier, which we can't do anything about. We have lobbied government repeatedly over it, that really the dental checkup needs to be free, because it is a means of potentially cancer diagnosis and saving a life.
And also it will save the NHS money in the long run, won't it?
Absolutely.
Robert, what was your experience then?
Well, interestingly, I was not in any of the risk groups, as Nigel's pointed out, so alcohol or tobacco. I've never smoked. I've drunk alcohol, but not excessively. So I didn't consider myself to be at risk. And when I got a sore throat, which turned out to be a persistent sore throat, I did the blokey thing and ignored it. You know, so it'll go away. It usually does. I'd suffered from tonsillitis in the past, and you know, and instead of having my tonsils taken out when I was a young lad, they left them in. But I get used to get the occasional infection. But after a while, it didn't clear up. So I did go and see a GP, and I was prescribed antibiotics, but it never cleared up again. I'm lucky in that I work in the dental industry. I work with dental practices a lot, and I'm in and out of practices, helping them with training and business consultancy. And when I was in there last, back in 2018, I asked one of the dentists to take a look, and he took a quick look at my mouth and said, "You need to go and see. You need to go to the hospital." I basically got a lesion on my right tonsil, not somewhere I would have expected to look, but it was immediately diagnosed as a stage 2 cancer. Luckily, I had great treatment, really, really good treatment, but and I'm free from the cancer, but I suffer from the lasting effects of the treatment as well. So that's a bit of a challenge. So I would certainly urge people not to ignore things. You know, if they have got a problem, as Nigel says, don't wait. Go and get it checked out with a dentist if you can get into one, or a GP, and just have a really good examination, because luckily mine was diagnosed at a very early stage, so I've not suffered from the cancer so much as the treatment. So but that's really my story. And I think it's just making people aware that you don't have to be in a risk group. I mean, yes, they obviously are at a high risk, but it can happen to anyone. I don't know what caused mine. I used to do a lot of DIY, cutting up sawdusty things and all sorts of materials, in the past, probably scraping lead paint off doors, who knows. But I never wore a mask because that wasn't the thing you did, really. But again, I'd urge people to take notice of all the safety precautions that are out there, because they're there, because people, they have found that these things do cause cancers. So that's really, it's a shock to me. I thought I was perfectly fine, but it's changed my life, in terms of the quality of life to some degree. Hey, I'm happy to be alive, and I'm really happy for the medical profession that helped me. But if I can help other people by telling them not to ignore any symptoms, go and get it checked. Don't think you're not in the risk group because you don't drink alcohol or smoke. Just if you have any problems, and go to the dentist regularly if you can. Go back to the regular checkups and ask them as well. They all do an oral health check, but they are pretty much under pressure with everything else that's going on at the moment. But it's a good time well spent.
Right. Well, thank you very much for pointing that out, Nigel. Before you go, can you tell people where they can find out more information? I've looked up on the NHS, and there was a lot of information there. But I presume you've got various information that you want people to know.
Yep. do go along to the Mouth Cancer Action Month website at mouthcancer.org, and you can also go to the foundation main website at dentalhealth.org.
Well, thank you very much, both of you, and I will be raising awareness more than just this month. I think it's a very important issue, and I'll dip into this story again. Thank you very much indeed.